Hello, my dear students. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today, we're going to talk about the procedure called indirect laryngoscopy. So, first question, what is indirect laryngoscopy? A procedure by which we study the interior of larynx indirectly. Very simple definition of the procedure. What kind of procedure is it? It's an OPD procedure. Okay, so no instrument is actually directly put into the larynx. What you're doing is just looking at the reflection of the larynx to study it. So, what is the procedure all about? This is the instrument you're using for the procedure called laryngoscopy mirror. What do you do to it? You warm it. Why do you want to warm it? Because if you put it inside the patient's mouth when cold, the warm air condenses on it and you can't really see anything in the mirror. So, what should you do? You should warm it. Test the mirror against your hand for it not to be too hot and then begin the procedure. Now, what are the basic rules of this procedure? There must be good illumination and you must be gentle with your patient. So, patient sits, you sit in front of the patient and you begin the procedure. What do? You ask the patient to open his or her mouth, protrude the tongue. Now take your thumb finger and the middle finger, hold a gauze in it and hold the patient's tongue with the gauze as shown here. Use your index finger to retract the upper lip away from the field of vision. Okay, keep your patient comfortable in this. See the grip here and see the index finger taking the lip away from the field of vision. Let the patient breathe, relax, and then hold the instrument like a pen, mirror facing downwards, and now gently insert it into the patient's oral cavity. See how this person is holding it like a pen and inserting it. So now, as this is the patient's soft palate, insert the mirror in, resting it against the patient's soft palate. You will not touch the patient's posterior pharyngeal wall. Why not? Because the patient will gag. So you will not be able to carry out the procedure. Why are you gently tugging on the tongue? Because when you tug on the tongue, the larynx gets pulled up. Okay, and therefore you are able to visualize the larynx better. The tongue is never depressed in indirect laryngoscopy. So now, how are structures visualized? This is your larynx. It is reflected now in the mirror, and this reflection is what you are seeing in the process. So you're looking at a reflection of the laryngeal cavity in the laryngoscopy mirror. What will you see? What you will see looks something like this. It's a completely inverted image, difficult to understand. So what do? My suggestion is, imagine that you're sitting in the patient's posterior pharyngeal wall and you're looking inside the larynx with your back against the posterior wall. Imagine it. Come, I'll tell you how to do this. You're sitting in the posterior pharyngeal wall. In front of you is the patient's tongue, the epiglottis, and this is the posterior wall where you are sitting. Attaching the tongue to the epiglottis is a median glossoepiglottic fold and two lateral glossoepiglottic folds. In between them, there are depressions called valleculae. Now, this is the aryepiglottic fold containing the cuneiform and corniculate cartilages, and this space that you are seeing here is the laryngeal inlet. Inside the inlet, you can see the false vocal cords on either side and pearly white true vocal cords on in between. This space in between is the rima glottis. Note, all this looks like it is in one plane. Although you know that false vocal cords and then below that is the true vocal cord, it all looks in one plane in the mirror. Okay, so the 3D effect is somewhat lost in indirect laryngoscopy. On the side, on either side of aryepiglottic fold, you will see the pyriform fossa depression. So if you're liking my lectures, do like and subscribe to my channel.